If they didn't have the feeding tube, they wouldn't be eating, and they wouldn't be eating because they are dying. At some point in time, continuing to use that feeding tube is actually going to cause more harm than good for that dying person. When someone is dying and the body is shutting down, one of the very first things to slow down and shut down is the digestive tract. A functioning digestive tract requires a ton of energy that that person now doesn't have energy for. All of that person's energy is being reserved for the most vital organs, the heart, the lungs, and the brain. And so when that digestive tract is shutting down and we are continuing to use that feeding tube, it can cause a whole bunch of problems: indigestion, bloating, nausea, vomiting, reflux, heartburn, and it can even cause something called aspiration, where contents from the stomach end up kind of coming up, back up, and they end up getting into the lungs, and they can cause immediate breathing problems. It can lead to pneumonia, and it can lead to a quicker death. It's very likely that the hospice team will be starting to recommend slowing down the use of that feeding tube and eventually stopping the use. And there's no exact timing, and it's very individualized for every single person. But two questions that I think are really important to ask are: number one, is that person even hungry? And the second question to ask is, how does that person feel when they're using the feeding tube? Is it making them feel worse, more uncomfortable? That's an indicator that their body, their digestive tract, is shutting down.